And we're recording. So welcome to part 2 of the Dance and Pain Science lecture with Mags Smith-Clark.
Thank you. That's great. We were just, one of the things about recording in this way is the amount of energy it takes up. So if we look at the emotional component, that's important. It's one of the things that we're skirting around as we discuss pain. So how emotions can excuse me, I can't speak, sorry. Okay, so we're going to look at the range of motion, fear of movement, and we're going to look at the review of scans. These two things come from having the conventional medical approach, and what we feel is it's not actually answering the question about the pain. So these things indicate to people who are experiencing chronic pain that they're not finding the solution. So we also then refer to questionnaires to help see what other symptoms they might have. And through research, what has come up is that there are certain personality types that find this particularly difficult to switch the body into the rest and repair mode. And so those personality types will be people that are hard on themselves, people who wish to please others. That would be more important to them to actually keep the peace around them. They don't like confrontation, and therefore they will not attend to the things that matter to them, that help them keep on an even keel. Those people also might be over responsible and have a tendency for perfectionism. So as you sit here watching the chaos of the start of this second section, you will notice for yourself if that triggers a perfectionist need in you, because it certainly wasn't perfect. So that helps you to identify that you may have a strain of that, as I do, as most people do. And that need for perfectionism can mean that we're hard on ourselves and can drive ourselves too hard. So if we take that into a dance studio and we're perfecting a routine over and over again, having that moment of insight that this is good enough, and when I actually get to perform it, if that is what was going to happen, the atmosphere and the whole feeling of doing that in a context of performance will just put the shine on what you've done so far. And it's knowing that that's enough. And that's a very difficult thing for us as dancers or as dance teachers to recognize, because if we go over into perfection, that way lies injury, as all of us will have experienced at different times. And then once we've got an injury, we've got that potential for it not to heal if anxiety hangs around that performance not being perfect, because in comes shame, in comes embarrassment, and all of that feeds anxiety. So the personality type has a place within this concept. There's also a place for childhood upset. So if childhood experiences were not as great as they could be, sometimes parts of those experiences linger into adulthood, and that can make a difference for patients that I might be seeing. So learning to shift attention is one of the tools used to address this, because I can imagine by now there is that question, the elephant in the room, which is, well, what do you do about it? What do you do about chronic pain? And it's about changing what's happening with the unconscious mind. This is really important, that it's the unconscious mind, because in the past, we go back to 1901 and that division of, you're either going to look at the mind or you're going to look at the body. And if you choose to look at the mind, that's somehow a little bit less than looking at the body. Then it became an issue that if someone who was looking at the structural body felt that this injury or this persistent pain was to do with how the person's brain was functioning, that information received by the patient was, that's actually kind of rude. That's not very helpful. And what I want to stress here is it's nothing to do with the conscious mind. It is the unconscious mind. Therefore, it's not rude at all, providing everybody understands that. So the term psychosomatic has all sorts of legacies around it of disrespect. And it's why I would never use that term. But I've thrown it in just to help with the understanding how this can be misunderstood, if that's clear, which it probably isn't. Okay, all right. So what we do, the elephant in the room, to actually help reduce the pain is modify the neural pathways. So we reduce the attention on the pain. There's lots of tools in the toolkit to do that. There can be an improvement with distraction. There can be an improvement for people that they'll report that when they go on holiday. And there are other things that indicate again that it is the brain, it's not a physical injury. So treatment tools. There's journaling and there's exercise. So I expect most people have heard of writing things down and that being a help, because it's allowing whatever is going on in that hamster wheel in the mind to have expression on the page. James Pennebaker did lots of research. He's still involved in research on how writing with a pen on paper can relieve stress. So one of the things that we kind of know is that if we make a list, the anxiety about all of the things we need to do will reduce. So if there are assignments due, it's good to write down when that needs to be handed in and work backwards with a list so that you can calm down. It's come out of the brain, it's on the paper. One of the things that James Pennebaker would suggest is that it's good for us to write about feelings and to do that for 10 minutes a day. Some people find that tremendously helpful. Other people, it doesn't work for them. And one of the things that's very important about this approach is that it's individual. So whatever your gut reaction to that is, that's perfect. That's the right reaction. So writing as an emotional release and a vehicle for connections rather than writing out a pain diary trains the brain to express the emotions, to express the anxiety rather than to focus on the pain. So there are then two ways of looking at this. You can keep writing in a special notebook and you hold it all there so you can reread it, or you can write it and you can tear it up. So if people have anger, they might choose the latter. So they might write it and then tear it up, because then it's gone. And that's very symbolic. So there are lots of different nuances around the journaling. Exercise is also something that I would bring into the recovery process. And that means starting slow, building up the confidence. So there is a real issue around a medical practitioner in a white coat saying, sucking of teeth, I don't think you should move that. And that then affects us physically, because we feel that if we move it, we will do damage. Whereas research has proved that moving helps. Why? Because moving is getting those hormones to move around the body. So the self-healing is going to speed up. But you don't need to move fast. Just moving is what will make the difference. So moving, that can be walking, it can be swimming, it can be dancing, any gentle exercise. That might include yoga, it might include Pilates. And it's a choice thing again. It goes back to what is right for each individual. So it's what you're drawn to. So if you do have an injury in dance, or you're teaching someone and they have an injury in dance, it's encouraging them to balance between resting and moving. So psychotherapy is another treatment tool. So intensive short-term dynamic psychotherapy is what we would use as TMS practitioners. And that means we're looking at expressing the anxiety, expressing whatever the upset is. And I describe that as putting it out on the table and then sweeping it off. If you went to psychotherapy, which in some cases that is an appropriate route, it's a much longer process. But our intention is to get rid of that pain as quickly as we can, or to reduce it as quickly as we can. And just that process of expressing the emotions can do that. So the stresses can be relationships, finances, living arrangements, work, past experiences. There's a range. And it's just giving the opportunity for the individual to just shine a light on each of those areas and see if there is anything there that is causing stress. The emphasis on theory as a tool to relieve pain is what we want to do. It is a way to release feelings, but it's also an active way of releasing the pain. So what we're trying to do is to get the pain to improve or to go away. So our treatment objectives can involve self-talk, which is a completely mad thing, but it's a really good thing to actually just bring into this discussion. So neural pathways recognize when the nervous system is hypervigilant. And what I mean by that is if the nervous system is reacting to every small thing, it's exhausting. So if we go back to the scenario, which was the example I used earlier, where you're practicing a routine in a dance studio, if it almost becomes obsessive to keep practicing, the effect on the body as a whole is that the body becomes super sensitized. And that means eating becomes an issue, drinking is problematic, people become short-tempered, concentration becomes an issue. All of that is part of what we would call the body being hypervigilant. So I hope that sort of explains that. So what we want to do is change the internal messaging. And this goes back to the brain and the body talking to each other. So if we hold the body in such a way that the body feels that there is an air of confidence about the stance, that will send a message to the brain. If we concave, and we take that Martha Graham approach, then that sends a different message to the brain. So it's fine within the dance, but then afterwards we need to take ourselves back up out of it, because if we go into a concave, then there is a sense of protecting the center, and that is a place of vulnerability. So we want to keep that confidence being reintroduced. So when we go to self-talk to accompany that, we want to actually focus again on my leg is fine, it's perfectly okay, it's created some pain because my unconscious mind is a little bit worked up about something, but it will not hold me back in this routine. So it's the self-talk that can make a difference, however mad that sounds. All right, okay, so we can process all of these issues through journaling, through therapy, through meditation, through contact improvisation, and through authentic movement. That means we have access to routes that other people who don't really have that much involvement in dance, they don't have access to contact improvisation, they don't have access to authentic movement. And those two can give us that opportunity to express if writing it down doesn't actually work for us. So how is this approach different? It's different from pain management because it's about changing beliefs. The expectations for relief are much higher. So we're aiming for resolution. We don't want to live with the pain at a certain level. We want it to go. So we need often to have a clinician to initiate and guide that healing process, to point out the connections and the clarity of the information. And what that means is we need someone who's going to understand the influence of the brain in pain, and we would be reliant on that therapeutic relationship. And what I would hope anyone looking for a therapeutic relationship would be seeking is empowerment. So it's about each individual feeling that they can take control and they can eliminate the pain. So what again I feel is that anyone who has anything to do with dance is a step ahead, because we know that dance is a form of expression and is empowering. So that piece we already have a taste of. It's just about seeing it through a different lens. So all of the results of studies that we've done up to now are clinically impressive. And if anyone would like to check that out, you can go on to the Psychophysiologic Disorders Association website, and there are lists and lists of research papers that you can have a look through. So with new diagnosis, there comes hope. And what we want to do is take that another step forward so that we look at this in the context of dance and start putting some data together, because there is that opportunity for research as well. So it's a refreshing new approach to pain. The sources of pain are often the nervous system and the brain, and not structural injury. So that is what we're going to summarize here. What does it mean? It means there's implications for patient beliefs. There's implication for healthcare provider communication systems. So the therapeutic relationship matters. There's implications for treatment. And also we've got to bring out this new understanding in a way that lifts our confidence, rather than us feeling overwhelmed that we need to go to someone with all the knowledge and keep returning to them like a boomerang. We can take on board some of this information, and as we get more used to it, we can fix ourselves. And I think that's a really important point. That's where the empowering comes from. We can learn to fix this ourselves. So psychology and education are playing a part. There's evidence from all the work on the brain that the brain can change. It doesn't stay set. It's that neuroplasticity means there's the opportunity for change. We can see all of this documented, as I said, in the papers on the website. And the most important thing to take away is that pain doesn't necessarily mean permanent damage. What it means is the unconscious mind feels something is out of alignment. Hence the possibility that the perfectionism is getting a little bit too much, and all the other issues that we discussed earlier there. So acute pain is often a signal to avoid damage or treat disease. Chronic pain, once properly identified, is just, it's kind of a signal. The response is to focus more on the emotional and psychological than that of the disease or damage. And what we'll do is take a break there.
Yes, that's great, Mags, and so much information in that section, which I know is going to stimulate. I've got lots of questions for the question and answer. I know it's going to stimulate some thoughts and ideas about empowering dancers, not only in the way that we empower their movement, but in the way we empower them as dancers within our pedagogy. So I think this is really, really important information, not only towards pain, but also the way we teach dancers and the way we teach dancers to manage themselves. So thank you for that section, and I look forward to the third and final section.
Thank you.